Okay, let's just admit it. We've all been there, right? Trying to navigate the healthcare system can be an absolute nightmare. It's this universal maze of frustrations, and it usually starts with the one thing none of us have enough of, our time. You're waiting for an appointment, then you're waiting in the doctor's office, and then you're waiting for your results. All that waiting just piles on the stress at the exact moment you're feeling your most vulnerable. And then, the paperwork. Oh my gosh, the mountain of paperwork. You're answering the same questions on every single form, and it's just this huge administrative headache for you and for your doctor. And just when you think it's all over, the bills start arriving. And they're basically impossible to understand. It's just this cycle of confusion and frustration over and over again. So for years, we've heard about AI that can predict diseases. But that's kind of like an app telling you your flight is delayed. Yeah, thanks, that's useful. But what you really need is someone to help you rebook the flight, right? So what if AI could finally start taking action? So let's dive into this because it's a really new way of thinking. We're talking about a fundamental shift, moving from an AI that just points out problems to an AI that actually helps solve them. And that's what we call agentic AI. You can think of them as these autonomous software agents that can understand a goal, figure out a plan, and then actually go and do it right inside the messy, complex world of a clinic or a hospital. They don't just analyze the system from the outside, they're actually in it, operating as part of the team. This slide really nails the difference. Predictive AI is like a map. It shows you the road, it shows you the destination, which is great. But agentic AI, that's like your GPS. It gives you turn-by-turn directions, it reroutes you around a traffic jam in real time, and it actively guides you all the way there. It's the difference between just knowing something and actually doing something about it. So what does this look like in a real clinic? Now, the idea here isn't to replace doctors, not at all. It's to give them an intelligent co-pilot, someone to help them navigate the unbelievable complexity of modern medicine. I mean, just think about what a doctor is juggling, especially when the pressure is on. You've got dozens of variables, lab results, patient history. It's a lot. An AI agent can help structure all that thinking, making sure nothing gets missed. This seriously reduces the cognitive load, and it frees up the doctor to do what they do best. When you boil it down, these agents are basically force multipliers. They help doctors make decisions faster, they handle all that tedious admin work, and that frees them up to focus on the most important thing, using their expertise to take care of the patient right in front of them. Okay, so now let's zoom out, because this isn't just about helping one doctor with one patient. Agentic AI can be a co-pilot for the entire healthcare system, optimizing all those backstage operations that actually make a hospital run. Take a process that seems simple but is incredibly critical, getting a lab result. Right now it's mostly manual, but an agent can see an urgent sample just got collected in the ER, automatically prioritize it, route it to the lab machine with the shortest queue, and track it until that result is back in the doctor's hands. We're talking about shaving off minutes that could literally save a life. And you can apply this same logic everywhere. An agent can optimize the operating room schedule to fit in more surgeries. It can manage bed availability to cut down ER wait times. It can coordinate staffing, and maybe, just maybe, it can streamline the absolute nightmare of billing and insurance denials. It's about making the whole system smarter and way more responsive. So, we've talked about how this helps doctors and hospitals, but let's get personal. What does this actually mean for you? Well, imagine having a personal health agent to navigate your entire care journey. The job of a patient-facing agent is simple, but it is so powerful. To inform you, to guide you, and to support you. It takes all those complicated medical plans and confusing hospital processes and translates them into simple, actionable steps you can actually manage in your daily life. This agent becomes your personal guide. It can help you prep for a scan, remind you to take your meds, and even help you make sense of your insurance benefits. The whole goal is to replace that feeling of anxiety and confusion with a sense of clarity and confidence. And this support doesn't stop with the patient. I mean, think about the millions of us who are caring for a child, or an aging parent, or a loved one. For caregivers, an agent like this could be an absolutely essential tool for coordinating schedules, tracking medications, and sharing updates. It empowers them and makes everything safer. So what happens when you put all of this together? When you have agents helping clinicians, agents running operations, and agents supporting patients? Well, you're not just improving little pieces of the puzzle anymore. You're starting to redesign the entire picture. These agents, they become the connective tissue of the whole healthcare system. They create this seamless flow of information from the back office to the operating room, all the way to the patient's living room. It becomes a system that can learn, adapt, and coordinate everything in real time. And that leaves us with the single most important question. If these AI agents are becoming actors on the stage of our healthcare, then who directs the play? As these incredibly powerful tools take on more and more active roles, we have to be the ones to set the rules. How do we make sure they're safe, that they're aligned with our values? Building the technology is just the first step. The real work is figuring out how we, as a society, are going to direct this new era of healthcare.